Thank you for your interest in forehead lifting. Over time, our foreheads lengthen and our eyebrows descend. This causes skin to build up on the upper eyelids. Below the level of consciousness, we elevate the forehead in order to lift the skin off of the upper eyelids in order to improve vision. And that causes horizontal lines on the forehead and vertical lines between the eyebrows. This can often cause a very aged appearance and make people think that you're worried or angry. Eyelid surgery alone would not be successful in relieving these lines and furrows in the forehead. So the purpose of a forehead lift is not necessarily to make the eyebrows look extremely high, but it's to relieve the lines in the forehead and restore a more youthful appearance to the forehead by smoothing out all those irregularities and worry lines that people develop over time. But for years now at the Cast Center, we're doing forehead lifting with a few small incisions using an endoscope, a special camera that we insert under the forehead in the small incisions to lift everything up and relieve everything that needs to be relieved through this tiny approach. This approach has the advantage of being associated with less complications. There's less risks to the procedure, and you end up with a less swelling and a faster recovery. Many times I'm asked whether someone should have an upper eyelid surgery or have a forehead lift. Well, they're not mutually exclusive. I know doctors that will tell patients that any upper eyelid surgery is doomed to bring down the forehead further, to bring down the eyebrows further, if you don't have a forehead lift at the same time. I don't know that that's always true, and I like to base this decision upon an individual's unique anatomy and what their desires are for the surgical result. Because the forehead lift is done with just an endoscopic approach and a few small incisions, most of my patients return to work after just a few days.